Good afternoon, Madam Chair Bonamici, Ranking Member Comer, and members of the committee. My name is Dr. Yo Jackson, and I'm a professor of psychology as well as the Associate Director of the Child Maltreatment Solutions Network at Penn State University. I'm also a research professor at the University of Kansas, and I've worked for over 20 years as a board-certified clinical child psychologist and a researcher on the development of resilience for kids exposed to trauma and child maltreatment. Thank you for inviting me to speak with you today. Child maltreatment is a significant public health problem. In 2017, 7.5 million children were referred to protective services, with 3.5 million children meeting at least the minimum criteria to warrant an investigation. Of those, 674,000 children were determined to be victims of child maltreatment. That translates to a child being significantly harmed about every 45 seconds. Child maltreatment includes experiences like neglect, physical abuse, sexual abuse, with neglect being the most common. Sadly, 1,720 children died as a result of child maltreatment in 2017, placing the United States second only to Mexico for the most intentional child fatalities in the developed world. Child maltreatment is second in terms of the most prevalent childhood public health problems in the U.S., just after obesity and ahead of things like attention deficit disorder, asthma, cancer, and autism. In 2015, the average lifetime public cost associated with child maltreatment is estimated to be over $830,000 per victim, coming to a total of roughly $428 billion in costs for the number of victims over the course of just 1 year. Money that could have been saved if abuse and neglect were prevented. Maltreatment is associated with a plethora of negative and often devastating outcomes. It's important to note that most victims are under the age of 7, a time of great plasticity and the developing brain and social interaction systems. Early childhood is a sensitive period for the development of social relationships and forming secure attachments, something that is not possible in abusive and threatening caregiver-child relationships. Child maltreatment has serious negative consequences for brain development, impacting areas critical for learning, memory, emotion regulation, cognitive abilities, decision-making, and social skills. Beyond the grave neurological and biological effects, child maltreatment results in a lifetime of negative health behaviors, such as risky sexual behaviors, obesity, substance use disorders, chronic pain, and cardiovascular disease. Maltreatment is consistently associated with higher rates of all forms of mental health diagnoses, including risk for self-harm. Youth exposed to maltreatment are 5 times more likely than their peers to fail in school, to leave high school without a degree, to become a teen parent, to be consistently unemployed, to experience chronic physical and mental health problems in adulthood, and are 3 times more likely to be incarcerated, homeless, or live below the poverty line as adults. The range of emotional, behavioral, cognitive, and social delays as a result of child maltreatment are limitations that some may be able to adapt to, but most will never overcome. If adequate prevention programs were in place, these negative outcomes would not occur. Moreover, the negative effects of maltreatment are significantly increased with each re-victimization, making what was a hard-to-treat problem much worse and increasing the odds of long-term maladjustment. Given that on average, a child referred for protective services will be referred for abuse concerns 3 more times before they reach the age of 18, child maltreatment is likely underestimated in terms of its impact in the research presented here. The bulk of primary prevention efforts currently fall under the definition of home visiting, where professionals visit parents in their homes and focus on the well-being of children ages 0 to 5. Several of these primary prevention programs have been shown to reduce reports of child maltreatment. A paper in 2018 reported the cost, benefit, or return of $4 for every dollar spent on universal primary prevention programs. In contrast, targeted prevention includes a host of programs implemented within protective services to improve home environments and protect children from another instance of child maltreatment. A cost-benefit analysis found that 2 of the most widely lauded targeted programs, Safe Care, returned over $21, and Parent-Child Interaction Therapy returned over $15 in benefit for every dollar spent on implementation. Although child maltreatment is pervasive, it's also preventable. Because most victims of maltreatment are young children, prevention programs are critical to avoid the biological and social development impacts, impairments, and downstream effects. Child maltreatment requires a comprehensive prevention strategy. The reauthorization of CAPTA is an exceptional opportunity to better support the systems that protect children from maltreatment. Through CAPTA, we seek to better coordinate our efforts across the patchwork systems of federal, state, and local agencies and services, to seek out efficiencies and best practices that are supported by an evidence base. Data-driven approaches are necessary to increase the research base and to advance knowledge on what works for whom. We also need to seek to find and develop innovative coordinated solutions that facilitate the feasible and sustainable involvement of schools, parents, adults, government agencies, and service providers. Coordination, data focus, innovation. These frames are vitally important for prevention because what we know is that our current efforts have shown little to modest impacts. What we are doing now is not enough to stem the tide of child maltreatment.